This Week in Virology, the podcast about viruses, the kind that make you sick. From Microbe TV, this is TWiV. This Week in Virology, episode 1278, recorded on December 11th, 2025. I'm Vincent Racaniello, and you're listening to the podcast all about viruses. Joining me today from Colorado, and Daniel Griffin.
Hello, everyone. Yep, I'm up here at 11,100 feet at the Mount Hayden Backcountry Lodge. It is spectacular. I love your background, Vincent, but my background's better.
The pipe? I don't know about the pipe.
That's the wood fire stove there in the back, and that's the pipe heading up. And I'm looking out at U.S. Mountain in front of me.
There's a mountain called U.S. Mountain?
Can you believe that? Yeah.
Wow. Well, good for you. Is it really cold there?
You know, it's cold outside, but it is very nice and warm here. That pipe that you were commenting on, nice wood-fired stove is warming things up. So I'm pretty excited here. But
well,
all right, we got a lot to cover.
No bow tie.
I know, no bow tie. I got my smart wool, and my bunting, and so. But all right, we actually have a lot to cover. We have so much to cover, Vincent, that I actually was like, I can't keep covering stuff. I'm going to save stuff for next week. But let's jump in with a quote from Rachel Carson. The more clearly we can focus our attention on the wonders and realities of the universe about us, the less taste we shall have for destruction. What do you think?
So true. Yeah.
Yeah.
But also, it's all driven by power and money, Daniel. So just look at the world around you. Cut it out. Stop being selfish, folks.
Yeah, maybe if people could come and just spend a little time here at the lodge with me and just reconnect with nature and themselves and their family and friends, there'd be a little.
You want Junior to come out with you and chat with him for a while? Okay.
Okay, you're asking too much. All right, so let's move on. I only have so much empathy and compassion. All right. So just a heads up that we're having lots of norovirus activity. It's actually pretty high level. So a lot of winter vomiting disease. And, it isn't even officially winter. What's going on? So remember, you got to really wash those hands with soap and water because most of those alcohol just doesn't do much. Why is that, Vincent? What's going on? Why can't I just use the alcohol and rub it all over my hands?
Very, very stable capsid. In fact, the soap and water doesn't disrupt it. It just washes it off of your hands. Like surgeons, they scrub for 30 seconds or something? Or they used to?
Yeah, there's like a whole period of time and you got to get under the nails. It's a whole ritual. Yeah.
It's really debriding your hands because the debriding.
Debriding. Yeah. All right. As opposed to I often see the transfer of soap and water, just sort of transferring soap. You really gotta get in there. So, and there's a benefit here. You don't want to be vomiting and diarrhea. So also to alert parents to this headline, botulism outbreak sickens more than 50 babies and expands to all by heart products. The outbreak now includes at least 51 infants in 19 states. And I think I shared previously, one of the first cases, my daughter was actually involved with the care. So, all right, and now we get to sort of the challenging part. But I think it's really important that we talk about this recent changes and Hep B comments from the current ACIP members. Now, you notice I refer to these as comments because a lot of us, as you'll see going forward, we've sort of relegated them to people making comments. So we read in SIDREP that after a contentious discussion, the Advisory Committee on Immunization Practices, ACIP, voted 8-3 to drop the recommendation for a universal birth hepatitis B vaccine dose and 6-4 to suggest that parents use serological testing, which detects antibodies in the blood to determine whether more than one dose of the 3-dose series are needed. Under the first recommendation, only infants born to mothers who test positive for hepatitis B would receive a birth dose, while parents of other babies would be advised to postpone the first dose for at least 2 months. Now, there was some good discussion, but it evidenced how much this is agenda-driven and not driven by any actual evidence of the best steps to protect our children. Presenter Tracy Beth Hogue who was named acting director of the FDA Center for Drug Evaluation and Research, questioned why the United States universally vaccinates newborns against hepatitis B when Denmark does not. Now, in response, subject matter Adam Langer, acting principal deputy director and associate director for science at the CDC's National Center for HIV, viral hepatitis, STD, that's sexually transmitted disease, and tuberculosis prevention, said that the United States is unique in many ways. Among them, Denmark, the entire country, has only 6 million people. The population of New York City alone is 8 million people. More than 95% of pregnant women in Denmark are screened for hepatitis B. This is far higher than the number in the United States. Prenatal care is free for both citizens and refugee or asylum seekers in Denmark. We all know this is not the case in the United States. We don't have this universal health care. I mean, I guess maybe what they want to say is we don't have to do this, but we're going to give everyone universal health care. No, that's not what they said. Now, Canada was cited as another comparison, and Canadian analyses also support the need for a universal birth dose. So, I mean, right there, why don't we sort of stop, Vincent? I mean, it's kind of crazy. These are like talking points of the anti-science people, you know, these musings about how come in Denmark, why do we have to do it differently? How come in these small countries in Europe, we need to get more in line with them, but we're not getting in line in the big picture. We somehow just want to get in line in these weird, you know, anti-vaccine stances.
Well,
Vincent?
It's used as an excuse because, look, Denmark doesn't do this, so why should we? It's an excuse because countries are different, you idiots. For God's sake, the U.S. is totally different from every other country in the world in terms of its population, its public health. And in fact, it doesn't matter if you screened 100% of pregnant women for Hep B, you'd still have kids getting hepatitis B because before the birth dose in 1991, half of the transmission of Hep B in the U.S. was not from the mother, was from other people who were infected. So, you know, Dr. whatever, Hogue doesn't believe this. Well, that's not about you believing it or not. These are the facts that in the U.S., half of the transmission is from mothers, half of the transmission is from other people. And so that's why doing a birth dose has reduced hepatitis B to almost nothing in the U.S. And if you want to go back to that, go to Denmark and tell them to do something different, Dr. Hogue. We don't want it here.
So, okay. So I have another section. So what do we actually know? Like, why is this bad guidance? Why are people, as we're going to get on in a little bit, really just not listening to these folks? So first off is the MMWR health and economic benefits of routine childhood immunizations in the era of the Vaccines for Child program, United States, 1994 to 2023, right? MMWR from the CDC. So this is from August 2024. And in this analysis, they look at the benefits of our current childhood vaccinations and find that among children born during 1994 to 2023, routine childhood vaccinations will have prevented approximately, ready for these big numbers, 508 million cases of illness, 32 million hospitalizations, 1,129,000 deaths, resulting in direct savings of $540 billion and societal savings of $2.7 trillion. Looking specifically at this is great because it doesn't just look at hepatitis B, but looking specifically at the benefits of hepatitis B vaccine, this one vaccine, hepatitis B vaccination, has prevented greater than 6 million illnesses. Hepatitis B vaccination has prevented 940,000 hospitalizations and over 90,000 deaths. And just I'll leave it in a link to what's really a great resource. Now to dive deeper, we have another document, and this is from our friends. This is the document Universal Hepatitis B Vaccination at Birth, Safety, Effectiveness, and Public Health Impact, December 2025. And this review looks at 400 studies spanning 40 years, finds no evidence that delaying the universal hepatitis B vaccine birth dose improves safety or effectiveness. This review also finds that birth dose vaccination does not cause any short, any long-term serious adverse events or deaths. They find that there was not any new evidence to suggest that delaying the birth dose would be safer or more efficacious. They did find that since the universal birth dose recommendation was adopted in 1991, nationwide pediatric infections have fallen by more than 95%, and infant infections have been almost completely eliminated. They found that the current vaccination schedule has helped prevent more than 6 million hepatitis B infections, nearly 1 million hepatitis B related hospitalizations. The birth dose reduces perinatal transmission by roughly 70% when used alone. And then when combined with hepatitis B immune globulin, protection increases from 83 to 97%. Birth dose vaccination protection against hepatitis B and related complications lasts more than 35 years. And delaying the first dose provides no immune protection benefit. And they also, as per that discussion, they also point out why the US is not Denmark. They make better boats. I really like their cheese, but delaying the first dose makes infants vulnerable to missed maternal diagnoses as well as postnatal exposure. In the US, about half of people living with the virus are unaware of their infection, and hepatitis B is highly transmissible and can survive on surfaces for more than a week. What's more, an estimated 18% of pregnant women do not receive hepatitis B testing, and only 35% of those who test positive receive the recommended follow-up care. So without protection, 90% of infants infected at birth will develop chronic infection, and 1 in 4 of these children will die prematurely of liver disease or liver cancer. Usually you're the one who's all fiery up on the soapbox.
Well, Daniel, when I used to teach medical students many years ago, the ones in the back row read the New York Times, okay? I think Dr. Hogue is one of those doctors who read the New York Times and didn't learn the proper information about vaccines. And so that's what we're stuck with today. So any doctor that reads the Times during class, don't listen to them. Hope you didn't, Daniel.
I did not.
Good.
Okay. I'm entertained that would happen. But okay, so here's the deal. So, okay, here's a bunch of people that they have an agenda. So many healthcare providers, doctors, medical societies, state health departments, number of alliances, really basically rejected this, what we refer to as a proposal. The regional health alliances were formed in recent months, largely in states led by Democratic governors to provide an alternative to the CDC, which really has lost the confidence of doctors across the country. This is reassuring. Private health insurance plans will continue to cover the birth dose of the hepatitis B vaccines. And basically the AAP, all of us are going to just continue actually doing what is scientifically appropriate. It's really interesting. Now I'm going off script. I try to script a little bit. Now I'm fired up. RFK Jr. is threatening, oh my gosh, this is not going to be the standard of care. If people start not following us, there'll be legal exposure. That's not true, because
liar.
He's a liar. I mean, this is evidence-based. This is the standard of care to actually protect children. It is not the standard of care to follow a bunch of anti-vaccine, anti-science folks. So yeah, when these babies get infected, when these babies get sick, when these babies die, in what way is that defensible? Some lawyer told me. Okay. All right.
So Daniel, I'm afraid that in red states, the doctors are not going to do the right thing. Is that a reasonable fear?
I don't think so. I mean, I think that this has gotten to the point, and this is, I'm going to discuss a study that was recently, it's a survey, it's gotten around that these folks are not a source of reliable information. So, and here's the story. So it appears that most people in the U.S. are aware of what has happened at the CDC and have stopped viewing this current group and their recommendations as worthy of really listening to. The National Foundation for Infectious Diseases, NFID, surveyed more than 1,000 U.S. adults from a pool of volunteers meant to reflect the U.S. adult population. Only 13% are even listening or trusting what's coming out of the current CDC, which is really the equivalent of people trusting TikTok and Twitter and other social media. And many, many more, almost half of the folks, who do they talk to? It's their healthcare provider. And so I know a lot of healthcare providers are frustrated. I was at a dinner last week talking to some of them where they're just I just don't want to have these conversations because people come in with their mind made up. We need to have the conversations because most adults in the U.S., are going to listen to us, and about half or so will actually believe what we have to say. Kind of crazy. More. We're still in our anti-science. We still have just a couple more things to cover, and then we're going to, rosy things like Marburg in Ethiopia. But now the FDA to investigate whether adult deaths linked to coronavirus vaccine. The FDA is doing a thorough investigation across multiple age groups of deaths potentially related to coronavirus vaccines, said Andrew Nixon, a spokesman for the Department of Health and Human Services. As if we were not doing post-license.
Exactly right. Exactly
which
right.
is just like, now seems like a good time to start looking into that in 2025.
It's just offensive, as if there's not, as you say, as if it hasn't been done before. It's just absurd.
Yeah. I mean, you don't become like an infectious disease doc or a primary care or a pediatrician, because you're following the money. You care about people. All right. Okay. Also, in Reuters, exclusive U.S. FDA launches fresh safety scrutiny of approved RSV therapy for infants. Now, I was like, okay, now they've crossed the line. I mean, come on, right? This is like the monoclonal antibodies. This is what saved Trump's life. But now they're like, not sure, right? So U.S. health regulators informed senior executives at Merck, Sanofi, and AstraZeneca last week that their approved protective RSV treatments for infants would be subject to fresh safety scrutiny following concerns, ready for this, raised by vaccine skeptics. Not raised by safety issues.
No safety. Makari and Prasad, they got together and they said, let's manufacture some mRNA-related deaths, and then we'll say we have to change all the vaccine safety stuff. And that's what they did. They just manufactured stuff. And now here we are. We have to look at everything again. It's crazy.
Yeah. I mean, this really I don't get. Like, this was always like everybody was okay with monoclonal antibodies. These are not vaccines, right? These are, let's give people the antibodies that they need to protect themselves. This is what really the Regeneron, right, that they gave to Trump, that saved his life. What's going on here? And we'll keep talking about all the data about so many children that are being saved. And not only is it keeping out of the hospital, not only is it keeping kids from dying of RSV, but all the kids who get RSV and then have asthma for the rest of their lives. All right, Marburg in Ethiopia. This is updated on the 10th, so just yesterday. Ethiopia's Ministry of Health has reported 13 laboratory-confirmed illnesses, including 8 deaths from the Marburg virus disease. And this is in the country's South and Sidami regions. Additional illnesses are under investigation, so we'll keep you updated there. All right, bird flu. The article, Contemporary Highly Pathogenic Avian Influenza, H5N1 viruses retain neurotropism in human cerebral organoids, was published in Open Forum Infectious Disease. So, sort of briefly, they analyzed virus replication kinetics, cellular tropism, and host responses to infection in human cerebral organoids. You're going to have to explain to our listeners what those are, Vincent. They inoculated them with these highly pathogenic influenza H5N1 viruses, compared these to some historical clade 1 viruses and a 2007 seasonal influenza A virus. Really, the big thing we're finding here is it looks like viral antigen and RNA were detected primarily in neuron and astrocyte-like cells. Interferon responses to infection were observed in a small population of bystander cells. Higher levels of cell death and pro-inflammatory cytokines and chemokines were observed in organoids inoculated with the historical HPAI, so the highly pathogenic avian influenza, H5N1 isolate. So, I mean, in a nutshell, I'm basically seeing highly pathogenic avian influenza potentially having the ability to get into my brain. Is that fair, Vincent?
Yeah, so the current clade, 2.3.4.4b, right? That is what they looked at here, because the previous circulating clades had the ability to infect the brain, and this one still does. It retains that. So what they do is they make organoids. It's very hard to get brain tissue and make cell cultures out of it, right? So they take stem cells and differentiate them into brain cells, and they have properties of the brain. That's why they call them organoids, and they're very useful. You can infect them with viruses and study them. So That's what we find here. And H5N1 is a nasty virus. There's no doubt about it.
It is. It is. All right. So I'm going to encourage people again to get on the email list, maybe even subscribe to SIDRAP. Quick way to get some updates. But yeah, here we read that LaGrange County, Indiana is once again the site of several major commercial poultry outbreaks of avian flu. According to the updates from the USDA's Animal and Plant Health Inspection Service. LaGrange has 8 detections affecting more than 100,000 birds, many of whom were exposed on commercial duck farms. In Elkhart County, Indiana, 15,000 birds were affected in 2 commercial duck meat facilities. We've also got detections in Florida, Nevada, Vermont, and Washington. Avian flu has been detected among 97 flocks in the past 30 days, including 40 commercial flocks, 57 backyard flocks, affecting 1.08 million birds in total. All right, screwworm. Kind of worried about this. We keep hearing about this, and now we're hearing Mexico has seen 92 human cases of myiasis. This is this fly, the screwworm fly. We sort of focus on the worm, the larva part, that actually will put these eggs right in any kind of small breaks in the skin, and then the larvae will actually invade and just basically turn healthy tissue into Swiss cheese. It's horrific. So Mexico's seen 92 cases caused by New World screwworm as of November 28th. Cases have been detected in 5 states, including Oaxaca, Yucatan, Campeche, Tabasco, Chiapas. Chiapas has had 79 reported cases, 10 of whom are still hospitalized. There have been 5 deaths in infected patients this year. So really,
so much for eradication, right?
We were doing so well. It's just, it's demoralizing. Now we have dead people. We have, just horribly crippled people from this disease. Measles. More cases of measles, right? As of December 9th, a total of 1,912 confirmed measles cases in the United States. Are we going for 2,000? Are we going to hit 2,000? I mean, oh my gosh, like what is the goal here? In Canada, week 48, another 37 new cases. They're up to 5,298. And hot off the press, just sent my way from a researcher who is down practicing south of us, who will remain nameless, right, in our current environment. Hundreds quarantined at South Carolina measles outbreak accelerates. So this is really accelerating in the wake of Thanksgiving travel, lack of vaccinations. This is what we hear from the state's Department of Public Health official. They've traced a sizable outbreak to a church in the state's northwest. Of the 111 measles cases recorded in that area, known as the upstate region, 105 involved people who were unvaccinated. 3 were partially vaccinated.
What do we got here? Adults mainly, or kids, or what?
So I didn't really get a chance to dive too deeply. So I'm going to leave a link into this this Washington Post article. Let's see if we can see here.
I can't. It's paywalled.
Yeah, somehow I'm able to get in. This is pretty cool. Well, I'm a Washington Post subscriber.
There you go.
So yeah, no, I'm not seeing that we get as much information as we'd like. Yeah, so we'll keep people updated on that. But yep, you gotta subscribe to the Washington Post. All right, flu. So I actually pasted like the SARS-CoV-2 activity here in the flu, but don't worry, you ignore that, Vincent, because we'll put that in somewhere else. But what I do have, what we like to have in this section, is our multicolored map of the U.S. And what is this? I feel like people have been following my travel history, right? Because we've got a lot of activity going in New York, cranking up in New York City. Colorado's also a hot spot. But yeah, we're really we're entering the flu season. We're really starting. If you look at the epidemic trend, it is growing in almost all of the country. So we're really heading into the flu season as predicted, right? An early flu season. We should get a peak here in December, January.
Looks like you should be going to Louisiana next, Daniel.
I might have to head down there. All right. Well, a comment for my fellow New Yorkers, from out here in Colorado, from Spectrum Local News. The number of children dying from the flu is slowly rising in the state. And according to Department of Health data, in the 2021-2022 season, 3 children died. The next season, there were 14 child deaths. 20 more kids died the year after. And last season, we had 27 children died from flu in New York just last winter, right? And that's this, making up that 280 influenza-associated pediatric deaths that occurred last winter. Now, only 4% of the kids that died from the flu were vaccinated. So, all right. So really kind of disheartening there. All right, RSV. We are full-fledged into the RSV season, and you can really just see that growing increase. One of the ER docs at the hospitals was asking her, when are we going to see this triple-demic? And we're kind of heading right into people getting flu, COVID, and RSV. Well, should we take RSV seriously? Is this just a problem for children? Well, yes, we should take it seriously. We have a couple articles to talk about. The first is the article, Intensive Care Unit Stay and Mechanical Ventilation Among Adults with Respiratory Syncytial Virus-Related Hospitalization by Age and Comorbidity Status, published in Infectious Diseases and Therapy. These are the results of a retrospective cohort study conducted using Optum Market Clarity Database to identify RSV-related hospitalizations among adults aged 18 or older. A total of 13,734 RSV-related hospitalizations were identified, including 11,838 unique patients. Of these, 10.2 were considered low risk, but 89.8%, so 90% were considered high risk. ICU admissions occurred in 31.2% of the RSV-related hospitalizations. About a third of the folks that end up in the hospital with RSV end up in the ICU. Higher risk younger adults had higher percentage of ICU admissions than older adults at low risk. So just sort of taking it seriously. People are ending up in the hospital. We're seeing deaths. We're seeing folks end up in the ICU. But not only just the acute, so you survive, you make it out of the hospital, maybe you didn't die, but then we have the article, Cardiovascular Events 1 year after respiratory syncytial virus infection in adults, published in JAMA Network Open. So in this first article, sort of following people a little farther down the road, we find in the cohort study, 17,494 matched patients with and without RSV infection. RSV infection was associated with 4.69 additional cardiovascular events for every 100 older individuals with infection in the year following RSV. So think about this. You get RSV, now you have an additional 5% chance of a cardiovascular event in the next year. So over the observed 365 days after this sort of time zero, 665 cardiovascular events occurred among 8,747 individuals with RSV infection, only 257 among the matched individuals without infection. So a total of 922 cardiovascular events, over 70% were attributable to RSV infection.
Similar things we've seen with COVID and flu, right?
It kind of changes this paradigm, right? Like we're always worried about like our blood pressure and our cholesterol, but here we're seeing like the majority of cardiovascular events attributable to infections, right? 70% just RSV. Yeah, and as you mentioned, we've talked about flu, we've talked about COVID. Like, how many people have a cardiovascular event who've not had a viral illness in the last year? It's becoming vanishingly small, right? So these other things may set you,
Seems to me that maybe people should get vaccinated, right?
Oh, man, that's crazy talk, Dr. Racaniello.
Sorry about that. I'm sorry.
All right. Hopefully people knew that was sarcasm, because, yes, we really are encouraging. And listen, if you haven't done it so far, and I know the majority of adults in the U.S. and the majority of children, majority of folks in the U.S. have not gotten vaccinated, there's still time. Get that flu shot, get that COVID shot. If you're eligible, get that RSV shot. Because even more news about RSV, long-term illness in adults hospitalized for respiratory syncytial virus disease, United States, February 2022, September 2023, published in EID. Here they surveyed adults 18 or older who survived hospitalization for RSV or COVID-19 during February 2022 to September 2023. And they do these physical functioning, quality of life surveys 6 to 12 months after hospitalization, right? 6 to 12 months. This is way down the road. They compared outcomes after RSV hospitalization by age, so folks under 60, 60 or over, to those hospitalized for COVID-19. They do all these models. Among 146 adults hospitalized with RSV, 27.4%, 6 to 12 months, reported severe breathlessness, and 21.9% poor quality of life at follow-up. Few differences were seen in post-hospital illness by age, right? So this was not just the old folks. After adjustment, participants with RSV had 1.81 times, so almost twice the increased odds of worse dyspnea than those with COVID. Oh my gosh, worse than COVID. Participants reported functional and quality of life impairments after RSV hospitalization, regardless of age. Yeah.
Well, it seems to me that people should start looking for some of those long COVID metrics in this patient population.
Yeah, like a long RSV, like a post-infectious viral RSV syndrome. Yeah, I mean, that's what we're seeing here. Now, what to do about it? Well, we have another nice article in the Lancet Infectious Diseases, Effectiveness of the Maternal RSV Pre-Ep Vaccine Against Severe Disease in Infants in Scotland, UK, a national population-based case control study and cohort analysis. So, as per the title, these are results of a retrospective, nested case control study with a cohort sensitivity analysis. The source population comprised all singleton live births in Scotland, what you could do with a health system like that, between August 12, 2024, March 31, 2025, as recorded in the Scottish Linked Pregnancy and Baby Data Set, the SLIPD, I don't know how you pronounce that, SLIPD. During the study period, 27,565 singleton live births were recorded in this database. 50% of the pregnant women got that RSV vaccine. 92% were vaccinated more than 14 days before delivery, because you want to hopefully have enough time. 354 infants aged 90 days or younger had an RSV-related lower respiratory tract infection hospital admission during the study period. Adjusted vaccine effectiveness against RSV associated lower respiratory tract hospital admission was 82% in the vaccinated infants. So this translated to 219 RSV-related lower respiratory tract infection hospital admissions averted just during this study period. So over 200, little babies end up not in the hospital. And what are these folks here in the U.S. trying to do? Trying to attack what is just incredible therapeutic. Yeah, so they want us to live in a world.
Insurance companies will pay for this vaccine and not have to pay for hospitalization.
Isn't it kind of crazy? Like, it actually makes sense. Like, it's, All right, so you can pay for the vaccine, or what about that monoclonal antibody that I was railing about before? The article Effectiveness of Nirsevimab, that's getting a monoclonal antibody in preventing respiratory syncytial virus-related burden, a test-negative case control study in bronchiolitis in Lombardy region, Italy, published in Pediatric Infectious Disease Journal, single-center study, provides an estimation of the Nirsevimab effectiveness in infants after its recent introduction, 82% in preventing RSV infection, 78% in preventing RSV-associated hospitalization, 84% in preventing pediatric ICU admission. Amazing stuff.
So tell me, Daniel, what the famous city is in Lombardy, Italy?
Don't know.
Don't look it up.
I have never been to Italy.
Well, that's a problem. You go all over the place, but Italy's a lovely country.
Okay, I'll go there next month.
Yeah, right. Milano is in Lombardy.
Oh, okay. All right.
It's all the way up north, right on the border of Switzerland.
Okay. I will have to go visit. Now, I'm going to go to Rome next month. It'll be my first visit.
Rome is lovely also. Yeah.
All right, COVID. Look, I pasted it in. Looking at our wastewater, we're seeing SARS-CoV-2 activity is high. But the data from the CDC, we haven't really seen it chewed up yet. So what's going on
it's
there,
still pretty
Vincent?
flat, isn't it?
Yeah, still pretty in the low region. So we'll have to see what's going on.
Well,
See if I trust.
it's almost 2 weeks behind. Who knows if we should trust this?
Well, I think that's the problem too. I mean, the data we're seeing in our wonderful multicolored lines is from like 2 weeks ago. So, you really, if you're going to provide data, you've got to actually provide it in a timely manner. So, I mean, we'll keep an eye because I do like this stuff. But just to let people know, the activity does seem to be not only high, but it looks like it's growing in a lot of parts of the country, particularly up in the Northeast. All right, moving into the COVID vaccine section. This is a great study, and this really is one to sort of, have in those discussions when people are wondering, I don't know, to vaccinate, not to vaccinate, what's a better choice? So, and then everyone's like, well, okay, I can understand older folks, but not those younger folks, that's crazy talk. Well, here's the article. COVID-19 mRNA vaccination and 4-year all-cause mortality among adults aged 18 to 59 years in France, published in JAMA Network Open Public Health. Very straightforward study where they looked at all 4-year all-cause mortality in individuals aged 18 to 59 years vaccinated with the mRNA COVID-19 vaccine versus unvaccinated individuals. They performed a cohort study that used data from the French National Health Data System for all individuals in the French population in this aged 18 to 59 range that were alive November 1st, 2021. A total of 22,767,546 vaccinated, 5,932,443 unvaccinated individuals were followed up for a median of 44 to 46 months, so about 4 years. Now, vaccinated individuals were older than unvaccinated by about a year. More frequent, women, 51.3 versus 48.5. More cardiometabolic comorbidities, and that was a couple percent higher in the vaccinated folks. So we're already a little worried that we got like a little bit older, a little bit sicker people in the vaccinated group. But during follow-up, vaccinated individuals had a 74% lower risk of death from severe COVID. But here's where it really gets interesting. Vaccinated individuals had a 25% lower risk of all-cause mortality. Isn't that crazy?
So not just COVID, which was great, 74%, but everything else, 25%, right?
Remember when we were hearing like all those people who get back, you're going to be dead within the year. And actually,
no,
pretty amazing.
These are the facts, folks, not the crap that the administration is giving you.
Yeah. So really amazing. All right. 2-year prognosis of mRNA vaccine-related myocarditis compared with historical conventional myocarditis, a population-based cohort study published as a letter to the editor in CMI. For all those bots who keep saying we never talk about vaccine-related adverse events, here we are discussing a vaccine-related adverse event. So I want to start with the first part of this letter. Extensive research has demonstrated the safety and effectiveness of messenger RNA, mRNA vaccines in mitigating the impact of the pandemic. However, myocarditis remains a concerning potential adverse event following vaccination. Generally, the prognosis of post-vaccine myocarditis has been reported as mild and self-limiting compared to other causes. Now, they did a previous study. So in the previous study by these authors that was done in Hong Kong, they confirmed a lower mortality rate within 180 days follow-up for post-vaccine myocarditis compared to conventional viral myocarditis. Studies from 4 Nordic countries and France also reported similar results. However, certain symptoms and diagnostic abnormalities persist even after 1 year of follow-up. And they link all this, which is nice. Now, a cohort study with longer follow-up period is needed to detect potentially long-term adverse events that take longer to emerge and ascertain the safety profile in the longer term. So this study, with a follow-up exceeding 2 years, aimed to explore the potential differences, right? So we're looking at post-vaccine myocarditis versus conventional other causes of myocarditis. So now they go to the results of this retrospective cohort study conducted by connecting routine healthcare records from the Hospital Authority of Hong Kong with vaccination records from the Department of Health. Final cohort, 912 patients, 109 with myocarditis following mRNA vaccine, 803 with historical conventional myocarditis. After adjustments with covariates, vaccination-related myocarditis presented a lower risk of all-cause death. So adjusted hazard ratio of 0.2, so about 80% lower risk of death within a follow-up. Patients with myocarditis had significantly decreased risk of developing heart failure. Adjusted hazard ratio 0.17, so 83% lower compared to conventional myocarditis. But this really is mixed news, right? Because vaccine myocarditis is different, tends to be mild, but in this series, there were 2 deaths, and these were assessed to be due to vaccination.
So I could not get this article. So how do they know these were due to vaccination?
Yeah, I mean, that's the challenge. They were determined, they were assessed, they were suggested to be due to vaccination. Yeah.
I think you have to be very careful when you say that, right? It's what we're criticizing Prasad of saying 10 mRNA deaths in children without presenting the data. So
yeah. I mean, that is tough because they're presenting this, and as mentioned, this is a letter to the editor in CMI, so sort of lacking, I think, sort of the depth. What is that? Is it when you make a claim that is sort of you need sort of a higher level of evidence to support it. Yeah. So.
Now, I'm not saying that the vaccine myocarditis cannot cause death. We just need to have the data that shows it, right?
Yeah. But what is really consistent here with all the other studies is that we are seeing, we keep saying, oh, it's milder, it's a different animal. And yeah, it is a different animal. It is not like, oh, we can count apples to apples. You get myocarditis after a vaccine, majority of the time it's milder, 80% lower risk of all these bad outcomes. So it is not the same thing. All right, COVID early viral phase, still very similar recommendations with early effective antiviral therapy in folks at risk of progression, early inflammatory phase, targeted anti-inflammatory therapies. And we continue, unfortunately, to see a growing number of individuals developing long COVID. So I'll leave in some links for some folks there. But we're going to wrap up this section before we get into our emails with, as we've been saying for a while, no one is safe until everyone is safe. I want to thank everyone so far who's donated. We're in our Microbe TV fundraiser. We're doubling your donations. We want to get up to a maximum donation of $20,000 to support Microbe TV. So go to Parasites Without Borders, click the donate button. Even a small amount helps. Bigger amounts, they help too. Really, if you want us to keep doing what we're doing, and if you want to help us help Microbe TV, go to parasiteswithoutborders.com and click donate.
It's time for your questions for Daniel. You can send yours to daniel@microbe.tv. Rick writes, I recently received a text from the CDC's vSafe asking if I've recently received an RSV or COVID vaccination. When I attempted to sign into my account, it stated that if my account was created before October 2023, I need to create a new account. This gave me pause and time to reflect if providing vSafe information is still a good idea. My concern is that if I truthfully answer that I had a sore arm and felt out of sorts for a day after receiving a vaccine, that information might be weaponized to push the vaccines are unsafe agenda. I realize that following the departure of Dr. Monarez, current leadership at the CDC probably has no interest in manipulating real data when it's easier to manufacture data, but I really don't want to provide them with additional ammunition. I would appreciate your thoughts on whether vSafe is still worth supporting. I also got a text as well, and I didn't answer it. What do you
really?
think?
Okay. Oh my gosh. I do worry, like, why are these texts going out? What are they trying to do? Who's generating those texts? I mean, it's really a bad place we're in. I shared early on, just most of us have lost faith in the current folks at CDC. It's basically been taken over. It's a coup, and they've come in with, all these people just really there to advance their agenda. And I'm worried, like, what are they going to do with what gets, used to be we were trying to understand what was going on. We had an honest commitment to the truth. We had a commitment to helping fellow human beings. But it's very clear what the commitment and motivation is for the current folks that are in these roles.
So when I got the first COVID vaccine years ago, I was asked to register for the CDC vSafe program, and I periodically would get texts from them. And when I got an RSV vaccine, I told them about that. But I don't see why we have to create a new account. I'm very suspicious of that, so I'm not doing it.
Yeah.
I don't trust the CDC. I'm sorry, there are good people still working there, but management, forget it.
Yeah.
Connie writes, thank you again for your dedication to giving us much needed and reliable information about viruses. I've been listening since COVID started. I'm 76 and 11 years ago had Pneumovax 23 and Prevnar 13 vaccines. I got pneumonia following a cold about 3 years ago. Haven't been sick since, never had COVID. I have intermittent mild asthma and asked my allergist about getting Prevnar 20. He said that due to my history, I'm eligible. My question is there any reason not to get Prevnar 20? Is the safety profile the same as that for other pneumonia vaccines? Since it's relatively new, is there enough information on side effects such as Guillain-Barré, the main thing I'd be worried about? Thank you so much for your opinion.
Yeah, no, thanks, Connie. The Prevnar 20 is effective, is very safe. I got the Prevnar 20. My wife got the Prevnar 20. You're eligible. I really think there's every reason to get Prevnar 20. And it's really been sort of a gradual tweaking of adding extra, from the 13 to the 20. So really not seeing any new safety issues there.
I got it too, Daniel.
Go for it. Try to keep you around, Vincent.
Mandy writes, with respect to the celiac plexus study, Dear Daniel, I'm a primary care doc with abdominal pain after COVID. I've noticed a good number of those with gastroparesis. I hope those doing the study can consider looking at gastric emptying studies before and after the block. I can see this is tricky as so many with gastroparesis can need 3 studies before they meet criteria.
Now, Mandy, this is excellent. I mean, it's always great when you can have, objective data, right? So, go ahead. And this was the study we talked about where they're targeting this imbalance between the parasympathetic and the sympathetic and trying to block that exaggerated sympathetic tone by doing the celiac plexus blocks. But it'd be really great to do gastric emptying studies before and after the block and see if we get some objective data there. So thankful suggestion, Mandy.
Alice writes, your information about the shingles vaccine and dementia has put getting it on my to-do list for 2025. However, when I was a child, I had multiple chickenpox infections before I seemed to develop immunity. I remember at least 3 were diagnosed and possibly 4, although I think all but the first were mild. Should I have any special concerns about getting shingles vaccine? I'm 71, active and healthy, except for a tooth. Have avoided all infection for the past 5 years. Never had COVID, though my husband got it once. I still mask up when shopping.
Yeah, so I mean, if anything, it would make me want to encourage you more to go ahead and get the shingles vaccine because something's up, right? I mean, certainly we see individuals who get multiple chickenpox infections, not heard of, but there's probably something about your immune system where you didn't just get the one and then maintain, immunity from chickenpox infection, and that risk of reactivation to shingles. So yeah, 71, definitely long overdue. Time to get those shingles vaccines.
And Susan writes, I'm writing with a question about research showing a positive impact of shingles vaccine on dementia outcomes. On the show released on December 6, Dr. Griffin noted that we may be learning that the reactivation of VZV, varicella zoster virus, is a possible cause of or contributor to dementia. As someone who had shingles in their 50s and then got Shingrix vaccine as soon as it was available 10 years later, I'm wondering whether any of the research on the positive effect of the vaccine disaggregates those who never suffered from shingles from those who had shingles and then later got the vaccine. Do we know whether there is a positive effect for the latter as well as the former? If so, is it strong?
Yeah, no, this is a great question, and I think a little deeper than we're able to dive at the moment. Our data is, looking at shingles recurrence, right? So, someone who gets shingles, they sort of ask the question, should I go ahead? Should I still get the vaccine? I already had shingles. And we usually say, no, you should, because you are at risk of getting shingles again. And we know vaccination reduces that. But we really don't know about the correlate here, people get shingles or not. in their risk of dementia relative to vaccine. We did see in those studies when they looked at people that were quickly treated with an antiviral, such as Valtrex, that there was a positive effect by jumping in quickly with the antiviral. But not sure we have granular enough knowledge with the vaccine studies on dementia.
That's TWiV Weekly Clinical Update with Dr. Daniel Griffin. Thank you, Daniel.
Oh, thank you. And everyone, be safe.